Welcome back to NorthState Health, the North State's first local health program.
And welcome back. Let's bring in Dr. Stephen Ferraro, a hand specialist at Shasta Orthopaedics in Reading. We understand that people often wait, we're going to get right into it, right into the topic. We understand that people often wait for several years when they start to feel the symptoms, huh?
Well, that's true, Tim. Commonly I get people who have symptoms for years and years at a time, and they sort of put up with it until it gets to the point where they just can't put up with it anymore, and so that's when they decide to get help.
Okay, so what symptoms are we talking about? What type of problems that people are going to be having with their hands?
Okay, with carpal tunnel, typically patients will get numbness in the first 3 digits of the hand. As you can see on the graphic there, there's actually a tunnel that the nerve to the main fingers of the hand, as well as all the tendons to the hand, go through. And it's about 1.5 inches long. And it gets kind of crowded in there, and the nerve gets squished and basically choked off and stops functioning. So people get tingling in the thumb, index, and middle fingers, can get some achiness, some weakness, and actually can get some achiness up the arm as well. And
so those are pretty serious. When you start to feel some of those things, you want to pay attention and at least go get them checked out at the very least, right?
Oh, that's true, because you can actually get some permanent damage if it waits too long. You can lose some muscle function, get permanent weakness in there.
Okay, let's talk about some of these contributing factors to these. What causes these type of symptoms that you're going to start feeling?
Okay, the majority of patients who get carpal tunnel get it because of no reason whatsoever. It just happens. There are factors that can contribute to carpal tunnel: overuse, repetitive use, diabetes, thyroid disease, other medical conditions like that can affect the functions of your nerves as well.
Okay, let's talk about something called grasping, I guess it is. What is that?
Just hanging on to things. A very common complaint I'll get with people is they're holding onto a glass or something, and then all of a sudden they just notice that it's dropped out of their hands. They didn't notice it, that it was going, until they dropped it. They couldn't feel that they were losing their grip. Okay,
so some of those symptoms are pretty, drastic, it seems. I mean, like we talked about some of the smaller symptoms that people need to pay attention to earlier, but that's something that you think you may really have to go get checked out, huh?
Yes, and again, people seem to not pay attention to it at first because it comes on very, very gradually, and it's only when it gets to the point where it really interferes with their function that they come seek help.
You're watching NorthState Health, the North State's first local health program.